there are different remedies for right-sided headaches. So let's start with those that give headache above the right eye. Chelidonium is the remedy that is indicated in liver and gallbladder disease. And actually, we use this point to treat, in neurotherapy, to treat problems with the liver. Right? Calibichromicum I use mostly for headaches due to sinusitis. Right? And the hallmark of it is actually the sort of main symptom, yellow sticky nasal discharge. And sticky is the key word for this remedy, sticky discharge. And these headaches are better with warm application. And there are actually few remedies, few types of headaches that are better with warm applications. Usually patients like to put cold packs, right? So if you see someone who tells you that, well, this is warm application that I use, is think of calibichromicum and see if you miss some history of sinusitis in the patient. Sanguinaria is very frequent right-sided headache remedy. The main thing about it that it is better with vomiting. So if patient vomit and feels better, I think of sanguinaria. So sanguinaria type of headaches, they start in the right side of the neck or in the right shoulder, right deltoid area. And the interesting thing about it, that it starts in the morning and the intensity of it changes during the day. Yes?
Question. I use all these remedies. You inject these remedies and you send them home with drops of those remedies?
No, I usually give them either in a liquid form.
You just give them the remedies, you do not just do the injectables.
Right, no, I don't have sanguinaria separately.
See, we have all that in Canada. Well, I'm bringing it from Germany.
That's
so
cool.
You just use the liquid.
Yeah, I
you do
use
not
liquid.
use it as in your injections.
Yeah, I use liquid by mouth, or I use
I see.
pellets. Yes. Right. And yes.
Any comments on the Uriel pharmacy, that they have different Uriel pharmacy? Are you aware?
No, I don't know this.
Yes. It's available in the United States. They have a
Okay, so you'll tell me later, right? So intensity changes with the sun. So the headache starts in the morning, gets worse by noon, and then decreases by the sunset. And again, vomiting improves the headache, right? Now, there are three more remedies for the right-sided headaches that I consider. Magnesia phosphorica is a right-sided headache that is better with hard pressure, right? And it's very intense and sudden. And sometimes gives like a neuralgic type pain. Semicifuga is a female remedy that is basically semicifuga. If it is on the right side, it is on the right side of the occiput, and then feels like a nail in the occiput coming from the neck. Right? It's worse with menses, and interestingly, semicifuga headache gets better with eating. So when the woman, usually it's a woman, when she eats, she feels better, but then when she stops eating, it comes back again. Right? And belladonna. And if you remember any remedy from today's talk, it should be belladonna, because this is a right-sided headache remedy with the severe. Okay, so this is the full name of the herb, belladonna atropa. It contains alkaloid atropine with anticholinergic effects. So the whole clinical picture of belladonna headache looks as if the patient was injected atropine. They may have tachycardia, intense pulsation of carotid, sensation of rush of the blood to the head, and the patient actually, the face may look red, and the head may even feel hot, and they put cold packs there, right? And they have a dry mouth and mydriasis. So, and these dilated pupils is the reason why they have the most severe photophobia. If you remember, like, there is 3 words to remember about belladonna headaches. It's violent, sudden, and photophobia. And if you remember at the beginning I said about cluster headaches, that's actually a hallmark of the cluster headaches. They're all violent, they're all sudden, and if there is photophobia, that's belladonna. So, and even, okay, so that's not, headaches are worse with the light, so they tend to stay in the dark room. They may be aggravated by menses. They are worse, they start actually usually after 3 p.m. They suddenly, and they may go like for a few hours or even overnight, and suddenly, and they don't tolerate any heat in any form, and they may be even worse, the headache may be even worse with sudden jarring, for example, of the bed. And they are better in a dark room with a hard pressure, with a tight head bandage, and with cold applications. And this is belladonna. And if I do neural therapy, of course, besides the crown of thorns, which is good for almost any headache, stellate ganglion, because they have tremendous sympathetic outflow. So to break it, stellate ganglion is the best for this, especially if it is right-sided, so we do it on the right side, of course. So this was a case that I had 10 years ago, probably. A 55-year-old woman who, wife of the doctor, who he brought her to me. She had severe right-sided migraine headaches few times a month, and they were bad. And they started suddenly in the afternoon, and then suddenly, usually at the end of the night. And usually when this kind of headache ends, they feel exhausted, right? So she couldn't work next day. And she had severe photophobia, and she stayed in a dark room, and not only in a dark room, but also isolated room, because she couldn't even tolerate vibrations of the floor when someone was walking there, right? So these are two main remedies for right-sided headache, belladonna and sanguinaria, right? And we distinguish them because belladonna has sudden onset, sanguinaria has gradual increase and decrease. Belladonna headache starts in the afternoon after 3 p.m. Sanguinaria starts in the morning. Vomiting doesn't improve headache for belladonna, and sanguinaria, vomiting improves headache, right? And photophobia is more specific for belladonna. Sanguinaria, usually not that photophobic. And sanguinaria patients frequently complain of very right deltoid. So, and as I was actually preparing for this talk, just this Monday I had a patient exactly who came with this right-sided headache here, and I was choosing exactly according to this, and this was sanguinaria case. So that's how I choose. When I look at this type of headache, sanguinaria, usually if it takes the full right side, it feels like half a band around the head. So, and in terms of trigger points that I always check for, it is suboccipital muscle that gives this type of headache. And of course, splenius cervicis also.